Senator Platt.
Leader, Radio Canada recently told the story of a truck driver in Quebec, paralyzed in his arms and legs since 2022. He chose assisted suicide in March, Leader, after developing a severe bed sore while spending 95 hours, almost 4 days, on a stretcher in a hospital emergency room. Trudeau Lemons, an expert in health and legal policy, summed up the sad case as follows. The reality, without albeit sanitizing, bed sore really is the reason why he asked for it. Quadriplegia combined with substandard care made him feel a burden. Leader, during a debate on C7, you said legislation provided safeguards necessary to protect the most vulnerable in society. How did this so-called safeguard protect this individual?
Senator Gold.
It's a tragic story which moved all of us when we read that. It's tragic, first of all, that...
Senator Gold.
I'm going to try to answer your question, Senator Platt, without taking exception to your instrumentalization of this. The safeguards in the federal legislation are designed to ensure that the standards that professionals apply, which are developed by their professional orders and the responsibility of their own orders of professional orders, are such to ensure that decisions that are made in the evaluation and assessment of individuals who are qualified meet the necessary standards to protect them. Unfortunately, federal legislation cannot protect individuals from the shortage of hospital beds or regrettably and tragically long wait times in the corridors of hospitals.
Senator Platt.
So your answer is they didn't. Stephen Laperriere, the General Director of an inclusion organization in Quebec, had this to say. The whole story is a crying shame. It's really a case of disbelief. What are we doing in order to help disabled persons or sick people to live in dignity prior to dying in dignity? That's a very good question, Leader. What is your answer to that?
Senator Gold.
Well, of course it's a fair question, and in the debate on medical assistance in dying, in the bill that we passed in this chamber, it was addressed by many senators and properly raised by many senators. This requires a serious all-society, all-jurisdictional effort within their jurisdictions to provide support for those who are suffering, whatever the nature of their suffering, and every jurisdiction needs to do its part. And that's the serious answer to a very serious question.